Hi, hello, welcome back. Let's discuss another interesting abdominal gynecological case. T2 weighted imaging. Write down your findings. This T1 weighted imaging on left. Write down your findings. Fat set T2 image. Write down your findings. Okay, the findings are a well-defined heterogeneous signal intensity mass with cystic areas in the subcutaneous plane and also invading and involving the muscle, abdominal wall muscle seen in the paramedial location in left iliac fossa. So this is the lesion, magnified view where you can see in T1. If you carefully observe, some areas of bright signal also are seen. So bright signal areas are seen here and here. So here. So these are the bright signal areas. And actually speaking in T2, it is giving a typical popcorn-like appearance. Repeated stages of hemorrhage could have resulted in this. And again, because of fat suppression, you could attain proper bright signal within the lesion on a fat side sequence. You could also appreciate a incidental simple ovarian cyst in the left adnexa. So this is in sagittal view where you can see that heterogeneous lesion predominantly in subcutaneous. Here you could carefully appreciate that it is indenting and involving the rectus muscle. The patient had a cyclical pain and the patient had typically previous history of C-section. So this is a case of scar endometriosis. So wherever there was a C-section scar, the patient has developed an endometriosis because of secondary endometrial implantation. So another companion case, similar case, it's quite a common pathology, and it's not, you should have a clear eye and classical history should be demonstrated. So you have to differentiate from other differential diagnosis. Presence of endometrial tissue in a previous C-section scar is called scar endometrial. You can see in skin, subcutaneous tissue, rectus muscle, rectus sheath, and it can extend into intraperitoneal space. Myometry at the site of the uterine scar also you can appreciate the scar endometriosis. They give a typical cyclical pain with on menstrual cycle. The phase imaging depends on phase. Whenever you get a immediately post menstruation, if the patient comes, you can see a lot of T2 bite signal and hemorrhagic areas, and it becomes quite confusing when it becomes chronic process. It looks like mass, and you have to differentiate from other differential diagnosis. The number of stromal and glandular elements are important. The most amount of bleeding is associated with inflammation. Solid, non-homogeneous hypoechoic mass is seen in USG with echogenic spots and echogenic strand and fibrotic component. The pattern of echogenicity is thought to be related to amount of distribution of hemorrhagic contents. The presence of multiple lesions within the scar increases the specificity of the diagnosis of scar endometriosis. Irregular, often speculated margins with infiltration of adjacent soft tissue is classical. Nodular thickening of subcutaneous tissues, often associated with hypoechoic ring of variable width and continuity, can be seen. Cystic changes are represent blood and lacunae from recent hemorrhage. Vascularity can be seen on color Doppler USA ultrasound. Typically appears as solid soft tissue mass directly associated with areas of surgical scarring and hyperattenuating compared to muscle in a plain CT. This is what you need to understand. So this is, as in our case, we can see cystic areas represented by small blood lacunae and various stages of hemorrhage within the endometriotic crypts, and heterogeneous nodule usually which is hyperintense associated with anterior abdominal wall and or pelvic scarring can be seen. So that is how you diagnose a scar endometriosis. If you see a tail sign, it may indicate infiltration of rectus abdominis muscle or any other muscle or fascia. So this has been described and there is paucity of literature. So finally, before putting a differential diagnosis, before diagnosing a case of endometriosis, you should see almost following things. You should, the other differentials are a desmoid tumor. It could be just a hematoma, a suture granuloma, a seroma. Seroma will be very clear fluid most of the times. Keloid is mostly fibrous tissue and it won't have any heterogeneous contents. It will be homogeneous, and lipoma and MR will definitely help. And even USG has a typical picture. Incisional hernia, Valsalva maneuver can help, and sometimes a retained surgical material can, and extremely rare in abdominal wall and subcutaneous side. Intra-abdominally, you can get confused. A neuroma, hemangioma, abscess, and all these things are a differential diagnosis. You can go through and read in this article in radiographics, women's imaging section. Thank you very much. Hope this video on scar endometriosis was useful for you.